welcome back. I tell you, the flavors are continuing right here on Open. I got an associate director of care management here with us today. That's for CABS Health Network, and she joins us to highlight the home health care services that CABS offers our community and to speak about the launch of their new social care network. So please welcome to the show, Andrea Kiliaris.
Hi.
Kiliaris.
Thank you, Bob. I'm happy to be here.
Oh, did you see all that food that we had on? I was ready to dig in, but they were counting me down. They said, you got to get into the next segment. But he had the knives and forks and everything ready.
You had me coming on. So
I know. So you're going to stay for food afterwards?
Sure.
There you go. So Social Care Network recently launched in the Bronx, right?
Yes.
And it's Medicaid driven.
Yes.
Tell us more about it.
Great. So there's over 7 million New Yorkers who are actively on Medicaid, 3.9 in New York City alone, and 1 million approximately of these Medicaid enrolled New Yorkers reside in the Bronx. So the Bronx is a very dynamic community of individuals, and we're bringing these services to folks so that they can get screened, assessed for services, and really determine what can we help with? What are their needs in the community? What are their needs for housing, food, etc., and how can we help support them?
Yeah. And how do we keep it going? Because, you know, everybody's like kind of afraid about maybe Medicaid getting cut.
So this is a part of an 1115 waiver from New York City, from New York State into New York City, right? So we're tasked with screening all of these Medicaid enrolled New Yorkers, really identifying what are their needs for their health care.
Yeah.
Everyone's got different chronic medical conditions and also social determinants of health that really play into their chronic medical conditions, right? So individuals, for example, who don't have stable housing, if someone's not stably housed and staying in a shelter, where can they store their medication safely so that they can take them and then help make their chronic conditions better and improve their overall health outcomes? So all in all, really assessing what New Yorkers have going on, how can we help improve what they've got going on and help them live healthier lives in the future?
Yeah, so it's sent down from the state, so it's a given. It has to go through.
Yeah. It's a
so
2-year
nothing can stop it.
Nope, nothing can stop it. It's a 2-year program that's really geared towards assessing, screening what New Yorkers have going on and helping connect them to care.
How long has this organization been in effect? You've been doing it for a while?
CABS Health Network has been around for about 45 years.
45 years.
Yeah, I'm lucky to be a part of such an organization that has a 45-year deep legacy in helping people. CABS began in home care services, working with folks in the community, getting them connected to a home attendant in the home. From there, they've broadened their reach, rebranded to CABS Health Network. Now providing care management services to help identify folks' chronic conditions. What do they have going on health-wise? Keeping folks healthy in the community and home environment.
Yes. Can you explain how the Social Care Network works?
For sure. So it's part of this 1115 Medicaid redesign waiver, right? Really taking a look at what do people have going on and how do we identify their needs to keep them healthier without having to go to the hospital, right? If folks know what they've got going on, they may be able to stay home. They may be able to get that home attendant. They may be able to get that home care. They may be able to get a designated care manager that can come to them to help them coordinate their needs, help them with transportation, help them with food insecurity, help them with any home remediation services, etc.
And these are all Medicaid eligible Bronx residents?
Correct.
Only the Bronx?
All of New York City, all of New York State. CABS specializes in the 5 boroughs in Lower Nassau County, but it's available for folks throughout New York State. There are 9 designated leads, so if you go to the NewYorkState.gov website, if you've got friends and family in outer regions of New York, please, we want to get all folks connected to care, but CABS specializes.
But this also helps with needs like meals and rent and staying healthy at home.
Let me tell you how that works.
Yeah.
So we've got individuals that we work with, and I'll give you an example of our client, Joan. Joan has a child who's diagnosed with asthma. She's been taking him in and out of the hospital. His name is Joey. Getting him connected to care is crucial, right? Identifying how do we help Joey's asthma get better through integrated pest management services in the home. Aside from that, Joan being a working mom can't really get everything done at home. we can provide a medically tailored meal service for her that will help her have meals that are ready so that she can focus on taking care of Joey better, so that she's not scrambling in the end. So we've got nutritionists on staff and really assess folks' chronic conditions to provide medically tailored meals in the home.
Wow, Andrea, I'm sure there's a lot of stories like that too, not only in the Bronx but throughout the 5 boroughs.
Absolutely.
Yeah. Anything that sticks out in your mind that you've helped with personally?
Absolutely. So we have a client, Gabby, who is hospitalized, and then coming back from the hospital can be daunting in and of itself, right?
Sure.
Getting home care in place, taking a look at how we can support her in the home with those medically tailored meals, looking at her house and dwelling as a whole. Does she need grab bars now to be able to get around? So through the home remediation of the social care network, we can install grab bars. We can help support her in any little bits of her care that will help her feel healthy in her home and community environment.
I mean, I'm glad that we have you on because we're creating the awareness that that people need to know about. I'm sure there's a lot of people throughout the 5 boroughs, tri-state area, and in this country who need to know about the organizations like yours because people are wondering, how do I survive? Who's going to take care of me? Who can I reach out to? Is there an organization out here? My family doesn't do it for me. Is there an organization that I can latch on to that would help me with my everyday needs?
Absolutely.
Food insecurities are big out there. Now, that's a big concern in the Bronx. What makes your meal delivery service different than others?
Our nutritionist really planning and working one-on-one with clients. I'll speak personally. I'm Greek, but we have a lot of folks that we work with that are Caribbean born. Those tasty palates of the Caribbean, the spices, the types of food that folks want to eat. How does that help or not help their chronic conditions, right? So our nutritionist really takes a look at an individual as that individual, helping them to create a meal plan that satisfies their palate and also supports their chronic medical conditions. Right? How do we get rice and beans in a healthier way? Low salt, addressing folks' hypertension, addressing diabetes, addressing foods and teaching individuals how to eat better for their overall health.
Yeah, wow. And that's the part of the nutritionist, right? They're going to come in and play a part. All right, let's take some salt out of it. But you know, they're going to want their own spices.
Absolutely. But working with our nutritionist, right? What types of food do you like to eat? What helps to satisfy your palate? But how does that help your chronic condition? And how can we change around a little bit of what you're eating so that it meets your needs overall?
Exactly.
Right? Food is medicine.
Don't only eat for taste, eat for nutrition.
Absolutely.
You know? A lot of people, of course, a lot of people like you and I, we fall short of that. We're guilty of that also.
Absolutely.
I want it to taste good.
But it can taste good, and it can also be healthy because food is medicine, and folks don't often look at the medicinal purposes of food and how they help to keep us healthy.
Yeah. You have that guide too, the medicinal purposes of the kiwi fruit or this and that.
Yes, work on that with your nutritionist.
Yes. Anything coming up that we should know about?
Absolutely. So we have our Circle of Care Awards coming up in October that we're
Circle of Care Awards.
Super excited about, where we look at current care of individuals and help to support folks overall. So we're super excited about that. We're in the community a lot. As we're launching in the Bronx, we're looking for more partners in the community. We love partnering with local churches, mosques, restaurants, schools when schools open, community events. Anyone who wants us to be a part, we're happy to table. We're happy to come talk about our services. We're happy to support our community. We want to be embedded in the community in the Bronx.
Well, you have Tawfiq Bousbasi. He's here.
Yes.
You can link up with them. And there's another brother here that I'll introduce you to in a little while.
Absolutely.
You know, they come on the show all the time.
Excellent.
You can link up.
Excellent.
So you said you're launching in the Bronx.
Yes, so we're launching in the Bronx. We're currently live and launched in Brooklyn, Queens, and Manhattan. We're launching in the Bronx and future launching also in Staten Island. So we are serving all of the boroughs in New York City.
Is there going to be a ribbon cutting or something?
Not a ribbon cutting for the organization, but for the program.
The program.
Yeah.
Okay.
So we're excited about that.
What, you have a date that we should know about?
No, we don't. We're launched as of July 1st.
Oh, okay.
Cool. Yeah.
So, all right. So you're right here.
Yes, we're
We'll
right
come
here.
in with a big boom.
That's
4th of
it.
July
Coming
holiday
in.
weekend and all of that
Yes.
stuff. Yeah. So hopefully we'll see you out in the community.
Absolutely.
There are a lot of organizations, there are street fairs and festivals and all that you can be a part of. I'm
Perfect.
sure you have a team out there with the banners and the table and
Yes, we do. We have a great
spinning
team
the
of
wheel
folks.
and all that,
Yeah.
and giving out the pens and
Yes,
letting
pens,
people know.
bottles, bags.
yeah, pens, bottles, and bags.
Yeah.
Good. I'm glad you came on. I'm
Thank
glad
you.
you're telling everybody about what you guys are doing and what you had been doing for the past 45 years.
Yes, about 45 years.
Yeah. Okay. Anything that you're putting together new in the future, besides doing
So,
The opening?
no, besides this, we're really just continuing our services.
Uh-huh.
We're continuing to engage clients throughout New York City and really emphasizing the social care network because it's new, because it's a way for folks to get connected to care in other ways that they've not been able to before, right? So the social care network supports social determinants of health, health-related social care needs. So it's addressing your diabetes with what you've got going on in the community. Can you get non-medical transportation to get you to the HRA office if you need to reapply for your food stamps? Do you need transportation to the food pantry? Can we get that connected for you? Can we do home remediation services, food and nutrition services, things that traditional healthcare does not offer clients?
They've got the right person for the job.
Thank you.
You presented well. Andrea Kiliaris. Give her a big round of applause in the studio and at home. We appreciate you and thank you for all that you guys are doing.
Thank you, thank you.
She is the Associate Director of Care Management, CABS Health Network. We appreciate you.
Thank you. Thank you, Bob.
Thanks for coming. All right, we'll take a quick break. I've got more. It's all happening next on Open.